Okay. Well, good afternoon, everyone. My name is Bogeum Choi. I'm a PhD student at the University of North Carolina at Chapel Hill. And this is a project that I've been working on with Gina, Heejun, at the end during the summer. Eugenia, who used to be at your program, who now graduated, also contributed a lot at the beginning. So I just wanted to mention that. And thank you all for having me at your lab meeting. We would appreciate any feedback you can share at the end of the presentation. Okay, so the title of this project is a content analysis of YouTube videos on college students' mental health. Oops. Okay. First, I'm going to talk about the goal of the research followed by specific research questions. Then I will briefly talk about the method, how the data was collected and analyzed. Finally, I will share preliminary findings and some of the interesting discussion points that I found. So our goal of this research was to understand how user-generated video content on social media, such as YouTube, can support college students' mental health. To address this research problem, we thought we first needed to look at what kinds of videos are out there for college students who might be using YouTube as an information source. So our first research question is, what types of videos are available on YouTube on this topic of college students' mental health? Then we were interested in exploring how those videos can support college students' mental health. I also wanted to briefly touch on why YouTube videos. What made us think that watching YouTube videos and mental health issues would be an interesting thing to do. Well, first, they're user-generated and they're video content, and they're shared on social media platform. In terms of content being created by individual users, it means that the content is voluntarily created and shared by users, individuals, or other versions of entities, and viewers are also aware that the information is deliberately created and published by another human being. Second, video, which not only involve text, but also involve audio and visual, can prompt more engaging and interactive experience and other means of communication from viewers. Third, the social media platforms such as YouTube is a way for people to connect with others of similar interests. In this regard, YouTube has been considered to provide not only informational, but also emotional and social support to viewers. Okay, for the interest of time, I'm going to keep the method part really short. So you guys can ask me questions later on so that I can provide more details. We first retrieved 1,930 videos from YouTube API keyword search on this topic of college students' mental health. And after removing duplicates and applying inclusion criteria, a total of 425 videos were included in analysis. And our inclusion criteria was simply consisting of two dimensions. Is it about college students and is it about mental health issues? In terms of analysis, we started by doing open coding, then collapsed them at later phase through iterative discussions. And we had specific categories that we wanted to focus on. And these are the main categories that we used qualitative coding for. We used these three dimensions to characterize the type of video. Under who, we had poster, audience, and voice and perspective. Poster was coded based on the name used in publishing the video. This could be the name of an individual or an organization, etc. Audience was coded only when there was an explicit mention of intended or targeted audience of the video. We looked at the video description that was written on the user interface and also watched the video as well to see if they talk about the targeted audience in the video content itself. And we coded not applicable when there was no explicit mention of it. And voice and perspective was the voice and perspective represented in the video. This could be a perspective of a person who is speaking in the video or a perspective of people who are present in the video. So for example, if the video portrays a life of college students living with depression, then the video was coded to represent a perspective of a student. And if the video contains an interview with a student counselor, the mental health expert was coded as another perspective. Under what, we coded two things, main topic and purpose. I actually did not code for the main topic category. That part was assigned to another collaborator. So I will only talk about the purpose in this presentation. Purpose was the motivation or purpose of creating and sharing the video. That was also mentioned in the video. This one, yeah, we also coded based on the explicit statement that was made in the video. I just wanted to address that. We also coded for other things, including what kinds of external links were included in the description and how long each video was. But the one that I think that's most interesting is this experiential information code. For this one, we simply used binary codes. When the video contains an individual's first-hand account of his or her own experience living with mental health issues, it was coded as yes, and otherwise it was no. Okay, let me quickly walk you through the preliminary findings for each category. So for the poster, and these are just simply showing frequencies of each codes. And for the poster, these categories are mutually exclusive because there was always a single entity who would be posting the video. And this is how we categorize different types of video posters. Slightly more than half of videos were posted by individuals. Then media agencies and university followed. Health-related organizations, interestingly, or may not be interestingly, ranked last. Under the health-related organization category, there were nonprofit health organizations, health clinics, and online health information platform. Okay, and in terms of audience, significant chunk of data was coded as not applicable, primarily because there was no explicit mention made about the intended audience. But when there was a mention of it, they mostly referred to college students, or they used a description of a specific situation that potential audience can find themselves in. For example, they would often say, for those who might be going through similar things as I, or if any of you out there can relate to this, blah, 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 and something along those lines. And this need category, the need code include cases where they say things like, I created this video for those who are in need of help, or those who are struggling. Okay. And in terms of voice and perspective, majority of the videos were representing the perspective of student group, which was nice to find out. And next major group represented was the domain expert. Mental health expert included psychiatrists, student counselors, psychologists, etc. And student advising expert included mostly faculty or university staff who would work with students as part of their career. All right, the last one would be the purpose. The yellow sticky notes are the codes, oops, sorry. Yeah, yellow sticky notes are the codes that are at a relatively granular level, and the blue sticky notes are the main themes that we identified, which are experience sharing, inform and raise awareness, and promoting help seeking. I just wanted to show you this affinity diagram so that you guys can have a basic sense of what kinds of purposes we identified in our data set. First, people created videos to share their experiences with mental health issues. Main feature of this theme is that when individuals come forward and share information based on their firsthand experience, viewers can gain two distinct kinds of supports from it. First is the emotional support, and the second is experiential knowledge. These two pink labels are sort of bridging concepts between the top level theme and these two clusters of codes. On the emotion side, I would say main codes were to share stories, to offer emotional support, and to share ordinary days of life as a college student, which was basically blogs. Here, story means people's stories of living with mental health issues on their daily lives. On the experiential knowledge side, we have to offer tips and advice as a main code. it was incredible to see how specific and practical all those tips can be. And it is also, I think, noteworthy that tips and advice shared by individuals were qualitatively different from those shared by experts. And then there was videos whose purpose was centered around informing people of the topic and raising awareness of the topic and helping people learn more about the topic. So sharing knowledge about the mental health issues. And then we had promoting help seeking. This covers the video where people explicitly encourage the viewers to seek out for help, with an important theme to capture in a sense that it may potentially induce behavior change to viewers. By watching a video with persuasive message like that, people may come to have different perceptions and behaviors around help seeking when it comes to mental health issues. And then again, this is another frequency table. So sharing stories were the most frequently found code, followed by informational purposes such as to inform and to educate. Then to offer tips and advice was third most common purpose. Promoting help seeking and raising awareness and reducing the stigma showed a similar frequency. Okay, and then discussion points. So based on what we have observed from dataset, we argue that YouTube can support viewers not merely as an information source, but also as a support system. And we specifically would like to point out these two things. The first is emotional support. YouTube can support people with connecting people of similar situation beyond just similar interests or hobbies by allowing them to share experience and concerns. And the second one is about the tips and advice that were shared by individuals who actually live through those mental health issues. We would like to argue that those can serve as a tangible support because those were very specific that you can actually start incorporating them into your daily lives, like right after watching the video. I found a certain group of videos very interesting, the ones in which a person sits down, shares their mental health journey, and provide tips and tricks they learned from living through it. The amount of personal details shared in the story was incredible. Their feelings, their thoughts, and reactions to symptoms. And like what we see is basically you are provided access to not only the information, but to other people. Like you are gaining access to other people who are living or once lived in a similar situation as yours in a more direct way. I say more direct way because you get to see them, hear them, and sometimes initiate a conversation with them by leaving comments or reaching out to them on social media. And those videos are the empirical evidence of these interactions, I think. It's been pointed out already that YouTube is a way for people to connect with others who have similar interests, as I mentioned earlier. But beyond that, based on what we've seen, we would argue that it is also a way to connect people who share situational need. And this is important, especially when those needs that you have are hard to articulate and to be effectively addressed in language. So a place like YouTube has a potential to meet those needs in a non-conventional way. And the second bullet point that I listed here is just, so the experiential information, poster, perspective, those were the dimensions that we used to do qualitative coding. But what if, I just thought that, what if you can, sift through information and filter the results that are retrieved from YouTube based on these dimensions? Like you would like to see videos that include people's firsthand account about this topic. I thought this would be especially more suitable for the situations like this, where you have a mental health issues and would like to hear about other people's stories. And these are the next step. First, so now we have all these codes. ready so we could look at the correlation between coded categories. I only show you guys the frequencies by each category, but we can see like which code in which category could occur more with other codes in other categories. And we also have user engagement data that was cached from YouTube web pages. So things like comments and numbers of likes and dislikes and the view counts. We can also look at the correlation between those data and the coded categories. Is a certain type of video is viewed more often than the others? Like, was it more interactive? What was it prompting more engagements from viewers, which can be represented by the number of views and comments. The second thing that I thought that we could do is doing an in-depth analysis on these interesting types of videos. What are the common characteristics among the videos? So for example, if you look at the right hand, like the table that is below, not at the top, these are the, I mean, this would be the video that I would be interested in more deeply looking at and collecting more. So the poster is individual. It's posted by individual laymen, not the organization. And the perspective, students' perspective is represented in the video. And the purpose of the video that is documented is to share the personal stories and to offer tips and advice and to offer emotional support. So all these three things are being done in the video. And like what are the common characteristics that these 35 or 57 or 120 videos have, and what kinds of tips and advice specifically that they're sharing? What are the level of specificity of the tips and advice that they're sharing, which would be different from what experts are sharing in the interviews. And the table at the top, I just found it really interesting as I was playing with the data set yesterday, as I was making these PowerPoint slides. So if you look at this is a video that are filtered just by purpose. So the purpose of the video included help seeking. The video was created and distributed to promote help seeking. And then by poster. And there were, for the videos that were posted by individuals whose purpose was help seeking, there were 38 videos. And the videos whose purpose was help seeking and posted by content production group. Content production group includes like TED or podcast, or videos that are distributed by a group of people whose professional job is to distribute the digital content. And then there was university and health organizations. And I also filtered the data by the experiential information, the existence of experiential information in the video. And if you look at it, for the videos that are posted by individual and content production group, there are a greater number of videos, they actually contain experiential information. And amongst the videos that are posted by university and health organizations, there are way more, greater number of videos that does not include experiential information. So like this shows that they are using different approaches and strategies in terms of delivering a similar message on the same topic. So health organizations might want to consider using the narrative and storytelling as a way to communicate help seeking promotion messages. Could be one thing that we can talk about, I think. So these are the next steps and kinds of analysis that we can do further along. And that's it. This is all I have. Thanks for listening to my presentation. And if there's any questions, I'll be happy to take.
Good job. Any questions?
I think it was interesting to see that there were so many experiential category videos made by people, something that we've been trying to explore too. And what I took from this presentation is that since Nadine and I are also working on like Alexa skills, Google skills review and what they do. I think sort of looking out for experiential, that category specifically would also help us to sort of better
Mm-hmm.
categorize the apps that we are reviewing as well.
Mm-hmm. Mm-hmm. Yeah. I think experiential information part is really interesting. Not only in this context of looking at people's mental health issues, but in many other contexts as well. So yeah, that's definitely something that I will be interested in looking at there.
So these experiential videos, they were just sort of developed like were they like sort of like podcast series, or were they just to have an idea of what they actually were?
So those, I actually missed what you were saying in the middle.
Yeah.
But well, like you mean like what does it look like when the video
Right.
includes
Like
experiential
were they
information?
part of a series, or were they like just one video and that's it, or something like that?
Oh, so yeah, whenever whoever are present in the video, if this person is sharing their firsthand experience related to mental health issues, then that will be counted as experiential information, yes.
Okay.
But if so, for example, if a counselor is talking about, oh yeah, one of my patient came in and talked about this, that would not be counted as experiential information because it's not her experience. It was a patient's experience that she was referring to illustrate as an example to the interviewers. So yeah, so experiential information is really about a person sharing what they have lived through in their voice. Yeah,
Right. Okay. Interesting. Thank you.
sure.
So some professionals, health professionals might think that experiential information is actually harmful because they don't want misinformation to be given out or that it's too specific to the individual. And so it's up to the individual to decide, the listeners to decide which information that they're going to take or not. And so that creates like lack of control over information.
Mhm.
So I don't know what Emily, like your profession being a medical student, how you feel about that kind of connection. And also like for Bogeum, for you to make that leap of let's, provide more opportunity to share experiential information in these organizations. Like what is that logical, connection that you can make?
Mhm.
I mean, I honestly think it would be beneficial in my opinion to kind of bring that perspective. I think it could be helpful, but I do agree where information can get a little confusing, and I feel like it's a very fine line of what's too much information, what's too much oversharing. But that's one of the results of the study that I did find actually very interesting was how little the different healthcare organizations are using these videos to connect on almost that like emotional level. And their strain seems to be maybe they're going more for here's like the facts of what you can do, XYZ. And I think it might and I kind of agree with your discussion. I think it could be very beneficial for different health programs to consider a different approach.
Right. I also want to say like two things. The first is I don't think this suggestion would be as much applicable to not mental health, but like health things like more disease that are more focused on the physical aspect and emotional aspect of it. And the second thing that because like listening to people sharing their stories can have potentially a positive impact when it comes to a more personal and intimate experience, like you living with depression and social anxiety. And that's a very, and that the health condition itself involves a lot of emotional aspect of human life. So I think that's where YouTube videos can be more beneficial than like someone who lives with diabetes talk about, oh, I ate this and it was so effective, like it worked out for me, so why don't you try it? I would say that there will be more guidance that would be necessary in terms of guiding people digest those information in, I don't know, more metacognitive way, or more in a more conscious and deliberate way. And the second thing is the tips and advice that was offered by experts based on their expertise were, I would say, living at a very, very broad and general level. Like, oh yeah, to manage your stress as a college student, you want to plan ahead, like keep your, I don't know, scheduler, or it's really important that you have some time for yourself and reflect on it. And then you might want to talk to your parents frequently, which are, you know, like it's not the information that can be uniquely accessible through social media or through videos or from other people's experience. But I just wanted to give you an example to show how specific the tips can be that is offered by individuals in YouTube videos. Like there was a student where to familiarize yourself as a student with a social anxiety, like she would always have a problem walking into a classroom where the students are already like sitting and like occupying other seats. She was sharing this tip of going into the empty classroom before the semester even begins, so that you can familiarize yourself to the external environment that you're going to be in taking classes. And she was filming herself doing this whole thing, which if I were a student who has social anxiety, I would find it very, very useful. And this is the kind of tips or advice that none of the videos that are posted by organizations would have. So yeah, those kinds of things were really, there were even people who would share a playlist of YouTube videos where you can listen to it and then relax yourself at the evenings, and all kinds of things. Yeah. So it was very interesting to me to look at all those things.